Well, good afternoon, everyone. I hope you are doing well and staying safe. Like many of you, I have been home the last couple of weeks because of the COVID-19. And I want to take the opportunity to look at some statistics. I've been doing a lot of investigating online from various sources and coming across some interesting information. So one of the websites I've been paying attention to is the Center for Disease Control, cdc.gov, and pretty easy from the main page you can find the cases in the United States. So as of April 11th, the CDC is reporting that the total number of cases is 492,000 and the total number of deaths is 18,559. So before I look at the statistics, what I want to say is, death is a real event. It brings up a lot of memory and grief. It can be a moment of fear and anxiety. It's a different experience for everyone. So I'm not trying to diminish the process of death here, but I want to take a look at what's being reported to us and how concerned we should be relative to the big picture. One of the things that I think is worthy of looking at is, are we seeing an increase in deaths? How does this relate to deaths in general? And I'm just going to take a look at the United States. And so here I did a search for death statistics in the United States. And I'm showing this route because I've been working off of the CDC's website right here, but it's really difficult to get through the CDC. And clicking on this page brings up deaths and mortality on the CDC's website, and this is the numbers for the year 2017. If you open up this page here, there's a PDF, and in here, scrolling down to page 9 it is, right there, these are the statistics that I looked at. So this is all the deaths for 2017, all known causes, 647,000 deaths from diseases of the heart, 599,000 deaths from malignant neoplasms, in other words, cancer, etc., etc., going down the list. I have this somewhere else that we're going to work off of. And going back to that page that I found from the search, you can see this information being repeated to a certain extent. 647 deaths by heart disease, 599 by cancer, going down the list. In a spreadsheet, I just repopulated that data. So here we have 2.8 million deaths in 2017 by all causes. That amounted to 7,708 deaths per day. Heart disease, 647,000 annually in 2017, 1,773 per day. Cancer, 1,641 deaths per day. Accidents, unintentional injuries, contributed to 465 deaths per day in 2017. Chronic lower respiratory disease, 438. Cerebrovascular disease, strokes, 401 deaths per day. Alzheimer's, 332 deaths per day. Going down the list, diabetes is 228. Influenza and pneumonia is 152 deaths per day. Suicide is 129 deaths per day. Each day in the United States, 129 individuals kill themselves. Chronic liver disease and cirrhosis, 114. And continuing so forth. They list the top 15 causes of death, and then all other causes, numbers 16 plus, amount to 1,539 deaths per day. that aren't listed here. So each day in the United States, 7,708 people die. So let's take a look and see where COVID-19 stacks up against that. 18,559 cases are being reported by the CDC. There's another page of reports that I wanted to look at. I was trying to find out when the first confirmed case was. And the closest I could get off the CDC's website was from this provisional death counts for coronavirus. And what they're reporting here is the deaths of each week. And so the first 5 deaths were reported in the week ending February 29th. So to calculate how many deaths there on average there have been per day since the first death, what I've done is roughly estimated the entire month of March being 31 days. Today is April 11th, so add 11 to that, and then I tacked on just a day or two into February. So on hiding the row here that shows the COVID deaths, the total as of April 11th, according to the CDC, is 18,559. So I roughly estimated that over 43 days, and that average comes to 431.6 deaths per day. So let's take and move this into its position here according to the average number of deaths per day. And as of now, things could change, but COVID would fall number 5 on the list according to average per day. So heart disease is killing 4 times as many people each day than COVID-19 is killing people. And if we take and combine the sum total of the top 4 causes of death, their total is 4,319 deaths per day on average. People are dying from, and this is something that happens day in and day out in the United States. So I'm just asking the question, are we overreacting? Is it really necessary to shut down our entire economy, considering, is this significant enough to take that course of action, to justify that course of action? And I don't mean to be, I'm not intending to be disrespectful to anybody who has died because of this. It's just, millions and millions of people have lost their jobs. Unemployment insurance claims are, I think, upwards of 30 million now. It's levels that I don't know if we have ever seen. And people at risk of losing their businesses that they have built for years and years and years. And one of the most frustrating things I find in this whole process is it's the individuals, it's the small businesses, it's the taxpayers that are once again suffering through a phenomena, whether it's natural disaster or a pandemic in this case. The effects of this are not being spread evenly across the board. And what I mean by that is we are all still paying rent and mortgages to the banks and the financial institutions. And if we have to suffer by not going to work, I think it's only fair that if our political financial system was really interested in the welfare of the people it supposedly serves, that we put a pause on all rent and mortgage payments. And if it has to be paused for a month or two, then once this is over, the severity of it is over, and we go back to to go back to work and having to pay for the roof over our heads, you can add onto the terms of those agreements 1 or 2 months. Why can't the financial institutions burden some of this pandemic just like we're being asked to? And if that was done, if you stopped all payments, if you just froze the markets, there wouldn't be any loss of money. It would just be like hitting the pause on a movie. So this is the reason why I'm taking a look at the statistics. I think we are overreacting by shutting down the economy. And let me share something even more disturbing about the statistics of these deaths. This here is a video which contains a perspective from Dr. Annie Bukacek, and I'm just going to let her speak.
Dr. Annie Bukacek is a board-certified internal medicine physician and sole proprietor of her medical practice in Kalispell named Hosanna Healthcare. She's been practicing medicine for over 30 years, most of those years in Montana.
The decision for unprecedented government-mandated lockdowns has been based on the alleged death rate of COVID-19. Is this death rate based on truth? When it comes to COVID-19, there is the additional data skewer that is, get this, there is no universal definition of COVID-19 death. The Center for Disease Control, updated from yesterday, April 4th, still states that mortality, quote-unquote, data includes both confirmed and presumptive positive cases of COVID-19. Mortality, quote-unquote, data includes both confirmed and presumptive positive cases of COVID-19. That's from their website. Translation, the CDC counts both true COVID-19 cases and speculative guesses of COVID-19 the same. They call it death by COVID-19. They automatically overestimate the real death numbers by their own admission. That most people who test positive for COVID-19 have mild or no symptoms. Therefore, testing positive for COVID-19 does not mean a person is sick with it, or if the person died, that they died from it. That most people who test positive for COVID-19 have mild or no symptoms. Therefore, testing positive for COVID-19 does not mean a person is sick with it, or if the person died, that they died from it. To drive this home, we need to understand how the CDC and National Vital Statistics System are instructing physicians to fill out death certificates related to COVID-19. Brace yourselves, and please pay attention, and let what I'm about to tell you sink in. The assumption of COVID-19 death can be made even without testing. Based on assumption alone, the death can be reported to the public as another COVID-19 casualty. The assumption of COVID-19 death can be made even without testing. Based on assumption alone, the death can be reported to the public as another COVID-19 casualty. The March 24th, 2020 National Vital Statistics System memo states, and I quote, "The rules for coding and selection of the underlying cause of death are expected to result in COVID-19 being the underlying cause more often than not. The rules for coding and selection of the underlying cause of death are expected to result in COVID-19 being the underlying cause more often than not." End of quote. The CDC report of cases in the U.S. memo from yesterday states the death numbers are preliminary, quote, and have not been confirmed. So, quote, the results are preliminary and have not been confirmed, end of quote. It's from the CDC website. Here's a quote even more laden with meaning. Stephen Schwartz, National Director of the Division of Vital Statistics, says in answer to the question as stated in the organization's COVID-19 alert, quote, should COVID-19 be reported on the death certificate only with a confirmed test? Should COVID-19 be reported on the death certificate only with a confirmed test? Check out his answer, and I quote from this memo, of which I have a copy, quote, COVID-19 should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death. Certifiers should include as much detail as possible based on their knowledge of the case, medical records, laboratory testing, etc. End of quote. I'm sure you all feel so reassured the government is asking doctors to provide their very best guesswork. Not. To reiterate, if a patient tests positive for COVID-19 and dies from another cause such as pneumococcal sepsis, it may be considered accurate to say that person died with COVID-19, not from COVID-19. Yet the CDC guidelines list they list this case as one more COVID-19 death, and they go to the next questionable death. They label that as COVID-19, and it goes on and on. You could see how these statistics have been made to look really scary when it is so easy to add false numbers to the official database. Those false numbers are sanctioned by the CDC. Those false numbers are sanctioned by the CDC as of their memo yesterday, April 4th. I have made physical copies of those memos in case more people start looking at their website and they decide it's too much truth for us. But based on how death certificates are being filled out, you can be certain the number is substantially lower than what we are being told. Based on inaccurate, incomplete data, people are being terrorized by fearmongers into relinquishing cherished freedoms. Based on inaccurate, incomplete data, people are being terrorized by fearmongers into relinquishing cherished freedoms. Figures don't lie, but liars sure can figure.
Alright, so I'm going to pause it there, and I want to show you directly what Dr. Annie's talking about. And by the way, this video can be found on YouTube. The one I showed was edited for emphasis, and it also has a video afterwards that we're going to take a look at too. But there's a YouTube address right there for Dr. Annie's video. And I'm not 100% sure how to get to this from cdc.gov. So if you start at cdc.gov/nchs/nvss/ you'll get here. Click on coronavirus there. You'll come to this page here. And personal death counts for coronavirus disease. This is that provisional page where I got the information about when the first death was reported or approximately reported. Guidance for certifying deaths due to coronavirus disease. Click on here and there's a PDF. Take a look at. And preliminary guidance for certifying COVID-19 deaths. So these two, we're going to take a look at just their PDFs because I highlighted to make it easier to find a few things. NCHS is receiving questions about how deaths involving the new coronavirus strain should be reported on death certificates. We are working on formal guidance to certifiers to be published as soon as possible. In the meantime, to address the immediate need, here is the basic information that can be shared in advance of the more formal and detailed guidance. It is important to emphasize that coronavirus disease 2019, or COVID-19, should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death. For example, in cases with COVID-19 causes pneumonia and fatal respiratory distress, both pneumonia and respiratory distress should be included along with COVID-19. This longer guidance goes into more depth, talking about the importance of mortality surveillance, providing crucial information about population-level disease progression, as well as guides the development of public health interventions and assessment of their impact. A notable example of the utility of death certificates for public health surveillance is ongoing monitoring of pneumonia and influenza. Purpose of this report is to provide guidance to death certifiers on the proper cause of death certification for cases where confirmed or suspected COVID-19 infection resulted in death. As clinical guidance on COVID-19 evolves, the guidance may be updated if necessary. When COVID-19 is determined to be the cause of death, it is important that it be reported on the death certificate to assess accurately the effects of this pandemic and appropriately direct public health response. When reporting cause of death on a death certificate, use any information available, such as medical history, medical records, laboratory tests, an autopsy report, or other sources of relevant information. Similar to many other diagnoses, a cause of death statement is an informed medical opinion that should be based on sound medical judgment drawn from clinical training and experience, as well as knowledge of current disease states and local trends. This section on the death certificate is for reporting the sequence of conditions that led directly to death. The immediate cause of death, which is the disease or condition that directly preceded death and is not necessarily the underlying cause of death, should be reported on line A. The conditions that led to the immediate cause of death should be reported in a logical sequence in terms of time and etiology below it. The underlying cause of death, which is A, the disease or injury which initiated the train of morbid events leading directly to the death, or the circumstances of the accident or violence which produced the fatal injury, should be reported on the lowest line used in Part 1. Other significant conditions that contributed to the death but are not part of the sequence in Part 1 should be reported in Part 2. Not all conditions present at this time of death have to be reported. Only those conditions that actually contributed to death. If COVID-19 played a role in the death, this condition should be specified on the death certificate. In many cases, it is likely that it will be the underlying cause of death. In many cases, it is likely that it will be the underlying cause of death, as it can lead to various life-threatening conditions such as pneumonia and acute respiratory distress syndrome. In these cases, COVID should be reported on the lowest line used in Part 1, with the other conditions to which give it rise listed on the lines above it. How do we know that much about COVID-19 for the CDC to make that statement? In cases where a definite diagnosis of COVID-19 cannot be made, but it is suspected or likely, e.g., the circumstances are compelling within a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed. In these instances, certifiers should use their best clinical judgment in determining if a COVID-19 infection was likely. However, please note that testing for COVID-19 should be conducted whenever possible. So as the good doctor said, seems like a lot of assumptions and presumptions are being made for COVID-19.